This is Donna. You are tuned in to the CallMD Plus opportunity, business-to-business opportunity, and welcome. We're glad to have you here today. As we noted earlier, this is a 6-year-old company. This is not a startup company. However, the direct selling portion of this business is brand new. You're getting in at the very beginning of a phenomenal growth opportunity. This is about a month old. We only have about 600 people currently in the entire United States operating this business. There is plenty of room for more growth and a lot more of you to come on board and take a part in this trillion-dollar opportunity. And we invite you to do just that. What are we talking about today? It's the U.S. healthcare in the United States. It's completely broken, and it's only going to get worse before it gets better. Over $2.5 trillion is going to be spent on healthcare alone this year, and that is expected to grow to over $4.5 trillion in the next 3 years. What are the big 3 issues with healthcare? Cost, quality, and accessibility. And unfortunately, these elements are constantly competing with one another. If you can't afford it, you can't get quality healthcare. And then if you can't afford it, how accessible is that good quality care to where you're located? You hear a lot of times people are traveling out of the country even to get services because of the cost, or the quality as well elsewhere is better or less expensive. Everyone fits into 2 categories here. You're going to find people that fit into either one. They have insurance or they don't. And regardless, our product absolutely fits both categories, and I'm going to show you why. Those that have insurance have some coverage for themselves or their family. They typically will have a monthly premium based on multiple criteria: their age, their health, their gender, past health issues. And remember, it's not just based on you. You can be perfectly healthy, the perfect gender, and I'm sorry to say men are looked at a little bit better because women can get pregnant and have babies and all those other issues. However, I don't care if you're perfectly healthy, the perfect age, the perfect gender, you're still lumped into a big bucket of other people and their problems and their issues and their health and their age and their weight and everything else, which will affect your monthly premiums as well. So keep that in mind. It is not just based on yourself, but a big pool of people that they are being insured at the same time. There's also an annual deductible almost on every single plan out there, and this is an out-of-pocket expense, as we know. A lot of times it takes forever to meet that. I carry a pretty high one. Mine has been around $10,000, and I have never met that deductible. So you're somewhat protected when you have insurance. Then you have the other side of the coin, those that don't have any insurance. There's no premium and no coverage, and they're willing to pay cash for services if they can get them. I know my doctor will not take a walk-in patient on cash because they don't have the ability to see them. They are overloaded with the current patients that they do have already. So if you have no insurance, that leaves you completely vulnerable, and your finances are really at risk at that point. Now, what we have here is not insurance. Remember, we are health assurance. Affordable health care for everyone in the United States? Probably not likely, but we are going to help give you something that will give something to everybody. There is a current estimate that over 50 million Americans are not covered by any form of health insurance. And I'm sure that number is quite a bit higher. I've seen estimates as high as 56 million. But as we know with any type of census, numbers are skewed and sometimes one way or the other. Now, look at this schedule here. This is written up by Kaiser. It was a survey of employer-sponsored health benefits. The light blue portion is the employer contribution. The dark blue is the employee or the worker contribution. And you'll notice it does not matter if you're on an HMO, a POS, or a PPO, or just all plans in general. There is significant amount of money out of the employer's pocket every year for that family or that single individual. And as well as the employee. Look at the amount of money that they still have to meet and cover for their plan every single year as well. It's quite staggering. The health insurance issues that we currently face, of course, are that a current average cost for a family of 4 with an 80/20 copay after deductibles, the average monthly premium that we're finding is going to be around $1,255. If it is employer-sponsored, there's an average of 30% that is paid by the employee. And of course, you have your deductible every year, around $2,500. There is always a wait period for new insurance as well, up to 60 days. With our product, there is never a wait period. There's also always a clause for pre-existing conditions, age, gender, etc. Remember, the insurance companies are out there to make money. They do not want to lose money. They know what they're doing, and they've done this for a very, very, very long time. Deductibles and premiums are expected to rise 25 to 35% over the next 3 years. Estimates are, again, 30% of all U.S. companies will completely eliminate employee-sponsored health care. And then we're all going to be forced to figure that out for ourselves. Now, when your employee or a family member is really ill, what do? They call their primary care physician, they go to a walk-in clinic and sit for hours, or they go late night to an emergency room. Or what about if you're traveling out of town, like I am quite often out of town during the week? What are our options at that point? Major issues that we face today in receiving health care, your primary care, severe shortage of primary care physicians, over 25,000 short now, estimated to be 130,000 by the year 2020. There's over 15,000 shortage of registered nurses to over 200,000 by the year 2020. Now, I know this for a fact. You have an average wait of about 22 days to see your primary care physician. My girlfriend was just telling me the other day that her doctor is so overloaded with patients that he is now offering this same vehicle that we're speaking about today, the telemedicine, for $3,000 a year to his current patients to have access to him 24 hours a day via the telephone. And you're going to see we're going to blow that out of the water with our packages. Without insurance, stepping into an urgent care is typically about $125. And I know this to be true. When I take my children into the urgent care, we spend $100 just to walk in the door. And then we will sit, on average, an hour to an hour and a half waiting to see the doctor at that point. My daughter came home a week ago from college with a sore throat. We went, called this line that we're going to talk about in just a minute. Within an hour, I was on the phone with a doctor, and within minutes, we were at Target picking up her prescription, and at a great savings as well. Again, your options are going to the walk-in or urgent care. You're going to have a 2 to 3 hour wait, and your average cost is going to be around $125. This can go against your deductible as well, but it is still cash out of your pocket. And then you're going to pay retail for your prescription most likely as well. Almost 70% of all ER visits are not life-threatening emergencies. Most times people are going there to alleviate the out-of-front expense in going to a doctor or urgent care, or it's after hours and they can't get into their doctor, or it's during hours and they still can't get into their doctor, so they find themselves waiting in the emergency room. Typical waits there, you're going to find 6 to 8 hours. The average cost of an ER visit today is about $1,500. Again, cash out of pocket. If you have no insurance, you will be billed immediately, and you have very few options to resolve this billing. Over 60% of all bankruptcies are caused by unpaid medical bills. And almost 90% of all bankruptcies could be avoided with an extra $500 cash in the household. And we're going to talk about how we can eliminate that problem as well. Whether you are for or against health care reform is not the issue here. The issue is being able to provide everybody with timely and quality medical care that they can afford. That's where CallMD Plus comes in. We have a choice: timely and affordable access to quality medical care, whether you have insurance or not. We have our RX Scripts card. When I used this for my daughter last week, we went to Target and picked up her antibiotic, $4. Normally, I spend $32 for that same prescription. The products and services that we issued, again, they are not insurance, rather health assurance, giving you a little bit of peace of mind that you are able to reach out and talk to a doctor anytime, 24 hours a day, 7 days a week, no matter where you're at. We are an outstanding discount medical program with telemedicine, concierge telemedicine. Ask your friends the next time you're out and about, do you have your own medical concierge? I guarantee they do not, and you can speak proudly about your concierge telemedicine program and get them on board as well as a customer of yours. We offer 3 plans to serve everybody's needs and budget. The basic plan at $19.95 per month, this covers your whole family, 65 cents per day, 24 hours, 7 days a week, 365 days a year, access to a registered nurse. If they feel that you need to be elevated to a board-certified doctor, they will do so, and there is a $35 consultation fee. Now, my insurance, if I go straight to my doctor, I have a $65 visit to go there. So no matter what, if I can do it over the phone, save me time, hassle, and money, I'm going to do that. All of your data will be stored in a CallMD, which is our HIPAA-compliant electronic medical record. It will be there for future use by yourself and your approved physician. You also are going to be entitled to discount prescriptions, up to 70% off on brand name and generics at over 60,000 pharmacies nationwide. Now, our second plan, which is very, very popular, is called the Ultimate Plan. This plan is at $49.90 per month, and what a bargain. You're going to have the Optum Health Allies, which is a United Health Group company. You're going to get what we spoke about just a minute ago on the basic plan, and as well as primary care specialist discounts, doctor, dental care, chiropractic care, infertility treatment, weight loss memberships, massage therapy, health and fitness, vision care, you name it. That's all going to be included. The VIP plan, which is what I have for my family, is $99.90. Again, this covers your entire family. My children that are away at college are covered. If you have parents living at home with you, anybody you're responsible for in your household is covered on your plan. I get everything we just spoke about, as well as I get to speak with the doctor with no additional $35 copay fee or any of that. So when I called last week for my daughter, I made a 5-minute phone call to a nurse. An hour later, the doctor called me back, sent us over to pick up our prescription, and that cost me nothing on the phone. I have that all covered in my $99.90 per month, as well as Premier ID Theft Protection Program, discounted legal services, and then, of course, the invaluable Patient Advocacy Protection Program. Should you find yourself in an accident or any type of immediate surgery need, and that bill is over $2,500, we will go to work for you. CallMD will help you negotiate that bill down very, very dramatically. That is part of your VIP plan benefits. What is the benefit to an employer in having this program for their employees? First of all, it's going to reduce annual health care for the employer. You'll be able to go in and show them how raising their current deductible and maybe even changing their plan to just a comprehensive catastrophic plan is going to be more beneficial, and then asking their employees to start with their CallMD program first. We definitely know through the 6 years that we've been operating that it will also reduce employees' sick days. How long does it take you if you need to go to the doctor's office? You have to go during working hours, and you typically have to allow for travel time to and from, and then the wait time to sit there as well, sometimes 3 or 4 hours out of the day to do so. All right, so that's going to reduce employee sick days and thereby increasing the productivity of the employee for the employer. Another benefit, it does begin immediately. There's never a waiting period, so starting within minutes of coming on board, they're able to use that program right away. Just like having an in-house medical doctor. No changing monthly rates. You don't need to worry like your normal plan that rates are going to continue to increase over time because of other people in that pool of plan, or that you've been using it so much that they're going to raise your rates. I think it's a great new hire incentive for them to bring on people right away and say, right away you're going to be able to access 24 hours, 7 days a week medical care. Now, also remember this is for any state in the United States. When you're traveling and you go to a different state and you call your current doctor, they cannot assist you in that state. They can only issue a prescription in the state that they are licensed. So when you travel with CallMD in your back pocket, you can be assured you are going to have access to a doctor in any state you're traveling, including Puerto Rico, and be able to get a prescription issued to you at the local pharmacy wherever you might be staying. So that's a great benefit. Now, let's talk about the employee benefits, which I did just cover a little bit there as well. You do have primary and hospital care. You're going to have vision, dental, alternative care specialists, and more. Very, very affordable as well. 24-hour access to board-certified doctors and RNs, and one price covers the entire household. Your entire family is covered in that price. Huge discounts on prescriptions. As I mentioned, I did notice that with mine. And then no exclusions due to pre-existing conditions. We are going to store all of your medical information as well for you, and the benefits are portable. You can take them with you when you leave the employer. You can just continue carrying on with those regardless if you're still employed with that employer or not. Now I want to thank you for listening to the B2B opportunity here, and just hang tight for just a minute. I'm going to go into what a lot of you are actually here to learn about, is the opportunity on the income side of this, the referral program. If you called or are joining us today to learn about how you can benefit from participating in this program, here it is. You will be able to go out to businesses, small, medium, and large, does not matter, and enroll their employees. And everybody that you get on board as a customer, whether it's your neighbor, a company, your mom and pop restaurant down the street, you're going to receive 33% every single month that they pay for their plan, whatever plan they're on. You're also going to get a fast start bonus up front of 50%. So whatever plan they come on, the following week, that's right, the next week, you can get cash in your pocket by going out and helping people get the benefit of 24-hour, 7-day-a-week medical care. 50% is going to be returned to you that next week. Now, we have a gentleman in the company that enrolled a large university, and I'm going to tell you, he brought on 8,000 employees. We don't know what plan he went on, but even if he went on our very smallest plan, the return to him on a monthly basis is in the multiple thousands of dollars. And that is something we can talk about in person if you are interested in something like this. Now, if you're seeing this vision like I am and thinking, I came on board originally as the B2B side, going out and bringing on businesses that needed help with their health care for their employees, or all the millions of smaller businesses that don't provide anything for their employees, I thought, you know, why not get people in other states that can duplicate what I'm doing, bring on people in their walk of life that they know every day that I may never get a chance to meet, go on and bring on other companies in the states that they live in. Every time they do that, I get paid every single month for helping bring them on board, anywhere between 10% to 33% on my own customers, and then as my group builds as well, you can see that I'm going to be paid all the way down the chain here. This can add up to be quite a staggering bit of money every month. There's going to be a residual portion in there every month. As people do pay their plans, you get paid every single month. Now remember, we're a 6-year-old company with a 90% retention rate. This is a very, very needed product today. It's very easy to become an associate with CallMD. So one time per year, $30 fee. With that, you're going to receive 3 websites, an associate site where you would send people like yourself looking at the business opportunity, your customer site where you would send people that are just looking to be part of the program for their family, and they don't need to know that there is a business opportunity here, strictly just a customer site, and then also your business-to-business building site where you will showcase our products and services to employers for their employees. You can absolutely get started in this phenomenal business for under $50. Now, included in that, as we stated, is your yearly fee of $30, and then you need to pick one of these 3 programs for your family. So again, if you were to pick this program here at $20 a month plus your $30, you're into this business for under $50. I don't know where you can go start a business today that already has a 6-year track record behind it for under $50. I'm going to touch on this page briefly, but know that this is something you can add at any point. Let's think of becoming an ambassador just like going into your own work every single day. If your employer said to you, hey, John, if you want to pay an extra $199 to me, I'm going to increase your pay with no questions asked for doing what you're already doing today, how many of you would raise your hand and do that? Absolutely, I would, and that's exactly what I did. I started day 1 as an ambassador because I know I'm here to build a business, a legitimate, lifelong business with residual income every single month. and in doing so, I want to get the highest pay possible. Real quickly, by adding the ambassador to your account, you're going to be paid anywhere between 25 and 50% check match on those people that you bring into the business, and that's a phenomenal thing. You don't want to leave that by the wayside. Again, that is something you can add at any point down the road as well. Let's recap real quick. You're going to enroll anybody as a customer or an associate, and you're going to receive a 50% Fast Start bonus immediately the following week. Starting in month 2, you're going to receive 10 to 33% every month on that associate or customer as they continue with their service. There's additionally 10 more ways that you will earn income in this plan, and you can see that at the Nexus Commission Plan scale at www.callmdplus.com. Now, again, I want to thank you all for joining us today, and if you do like some more information, please feel free to reach the number below or click on the link below and be taken to a site for more information, or sign right up as well. Thank you and have a great day.